Dr. Michelle, you worked at a major hospital in New York City. What was the typical recommendation for someone who, let's say, has a milder degree of hearing loss who comes into the clinic for tinnitus and you're recommending different treatment options? Would you say that also at a major hospital in New York that tinnitus maskers or hearing aids were recommended to those patients? And if not always, then why not?
Yeah, absolutely. I mean, anytime someone had any degree of hearing loss, and if they noted having difficulty hearing in any situation, then we always were recommending the use of hearing aids. And then on top of that, if they were complaining of tinnitus as well, then we often also recommended hearing aids, but with tinnitus maskers. And so oftentimes the individual, depending on whether or not the tinnitus was disruptive all the time or at specific times, we may have programmed specific tinnitus program versus having the masker, the masking noise, the background noise all the time in the general program that the hearing aid would start up on. So that way the individual could have the option of adjusting and choosing when they want to have that masking noise put in. And oftentimes they have now Bluetooth hearing aids, so they would also be advised as to some of the tinnitus apps that they could use to help stream their own kinds of sounds. So if they didn't want to use the built-in sounds that the hearing aid had, they could also select individual sounds that help them. And we could adjust the mix ratio between how much amplification, how loud the amplification is from the hearing aid versus how loud the tinnitus masker or the Bluetooth streaming was. So that way they could have the streaming audio, whether it was like, some kind of nature sound or white noise playing at, let's say, 20% of the volume of the general amplification. So there's a lot of different modifications that we were able to do, but generally speaking, we would recommend hearing aids with a tinnitus program and definitely hearing aids that had Bluetooth, which now seems to be the norm. Most hearing aids that you could get on the market have Bluetooth capabilities. And something else that for someone who has a mild hearing loss, where maybe the hearing loss is secondary to the tinnitus, there are different levels of technology for hearing aids. And so for that individual, we would oftentimes recommend more of an entry-level hearing aid because they aren't having many difficulties in different listening environments or not having difficulty listening in noise. So it wasn't very necessary for them to have to spend a lot of money on high, the premium technology hearing aids if those aren't the needs and the difficulties that that person is having.